Vaginal yeast infection. 7 natural remedies. Remedy number 1. Coconut oil. Coconut oil contains lauric acid and caprylic acid, which have strong antifungal properties. Studies show that coconut oil can inhibit the growth of Candida albicans, a type of microscopic fungus that can grow in the vagina. For best results, choose 100% pure, extra virgin coconut oil extracted through cold pressing. Since coconut oil is solid at room temperature, melt it using a double boiler before each use. Once melted, ensure the oil is not too hot to avoid burns. Dosage and use. Vaginal insertion. Use a clean tampon or vaginal applicator to insert a small amount of melted coconut oil into the vagina. Let it work for 1 to 2 hours maximum, then rinse gently with warm water. Repeat this process twice a day until symptoms disappear. Remedy number 2. Plain Greek yogurt. Plain, unsweetened Greek yogurt is a natural and affordable remedy with 4 key benefits for treating vaginal yeast infections. Restores vaginal microbiome balance. The probiotics in yogurt help create a healthy vaginal environment by producing lactic acid, which maintains an acidic pH level that discourages the growth of Candida. Antifungal effect. The probiotic bacteria in yogurt have antifungal properties that can limit the proliferation of Candida albicans. Soothing and hydrating. When applied topically, yogurt can help relieve itching and irritation caused by the infection. Strengthens intestinal microbiome. Regular consumption of yogurt improves gut flora balance, which can indirectly prevent recurrent vaginal infections. Dosage and use. Oral consumption. Eat 1 or 2 servings of plain, unsweetened yogurt per day. External application. Apply a small amount of yogurt to the vulva to soothe the irritation. Leave it on for 10 to 15 minutes, then rinse gently with warm water. Vaginal insertion. Use a clean tampon or vaginal applicator to insert a small amount of yogurt into the vagina. Leave it for 1 to 2 hours maximum. Then rinse gently with warm water. Repeat this once daily for 3 to 7 days in cases of mild symptoms. Remedy number 3. Tea tree oil. Tea tree oil contains active compounds, primarily terpenes, known for their antifungal, antibacterial, and antiviral properties. Research shows it is effective against fungal strains, including Candida albicans, a common cause of vaginal yeast infections. Mix 1 to 2 drops of tea tree oil with 1 teaspoon of a carrier oil, such as coconut or jojoba oil. Dosage and use. External application. After dilution, gently apply the mixture to the vulva with a clean cotton swab. This can help soothe the itching and reduce fungal overgrowth. Suppositories. Use tea tree oil-based vaginal suppositories specially designed for this purpose, available in pharmacies. Sitz bath. Add 3 to 5 drops of tea tree oil diluted in a tablespoon of carrier oil to a basin of warm water. Sit in the bath for 10 to 15 minutes to benefit from its antifungal properties. Precautions. Limit sitz baths to a maximum of 5 to 7 days. Avoid tea tree oil if you have a history of allergies to essential oils or perform a patch test before use. Remedy number 4. Apple cider vinegar. The natural acidity of apple cider vinegar can inhibit the growth of Candida albicans, the yeast responsible for many infections. Dosage and use. Bath soak. Add cup of organic, unfiltered apple cider vinegar to a bathtub of warm water. Immerse yourself for about 20 minutes. This method helps restore the natural vaginal pH and eliminate harmful microorganisms without disturbing beneficial bacteria. Precautions. Avoid vaginal douching with vinegar, as it may remove beneficial bacteria, increasing the risk of further infections. Remedy number 5. Berberine. Berberine, an alkaloid extracted from plants like Berberis vulgaris, is known for its powerful antifungal properties. It works effectively against Candida albicans by disrupting its cell membrane and preventing biofilm formation, making the fungus more susceptible to treatment. Dosage and use. Capsules or tablets. Take 400 to 500 ml standard berberine extract 2 to 3 times daily for 7 to 14 days. Sitz baths. Dilute 1 teaspoon of berberine tincture in 500 ml of warm water and use once daily for up to 7 days. Precautions. Avoid berberine during pregnancy or breastfeeding. Consult a healthcare provider, especially if taking anticoagulants, antidiabetics, or antihypertensives, as berberine may enhance their effects. Remedy number 6. Boric acid. Boric acid is a natural remedy with antimicrobial and antiviral properties. It also adjusts the vaginal pH, making it less hospitable to fungi like Candida albicans. Dosage and use. Vaginal suppositories. Insert 1 boric acid capsule, typically 600 mg, into the vagina before bedtime, once daily for 7 to 14 days. Use a pad, as it may cause temporary discharge. Precautions. Do not ingest boric acid, it is toxic if swallowed. Avoid use during pregnancy or if you have vaginal ulcers. Consult a doctor before starting treatment. Remedy number 7. Zinc. The fungus Candida albicans requires zinc to grow. In cases of zinc deficiency, it produces a protein Pra1 that enables it to extract this metal from nearby cells and vaginal mucus. When Candida albicans produces large amounts of Pra1, it triggers an immune system defense response and inflammation. Researchers tested a vaginal gel containing zinc on women with recurrent infections. The gel was applied nightly for 2 weeks, then twice weekly for 3 months. 8% of the patients experienced symptom relief. Dosage and use. Topical application. Use a vaginal gel containing zinc, typically based on zinc gluconate or zinc sulfate. These products are sometimes already available to treat vaginal dryness. Apply a small amount of gel directly into the vagina using an applicator or clean fingers. Once a day at bedtime for 2 weeks, then twice a week for maintenance. Oral intake. 15 to 30 mg per day of zinc gluconate, citrate, or picolinate. Consult a healthcare professional to avoid overdose, as excessive zinc intake can disrupt the balance of other minerals, such as copper. Precautions. Always seek advice from a doctor or gynecologist before using zinc gel, especially if you do not have a confirmed diagnosis. Excessive zinc intake can cause side effects such as nausea, headaches, abdominal pain, and disruption of the balance of other minerals, like copper. Zinc can interfere with the absorption of certain antibiotics, tetracyclines, quinolones, or thyroid medications. Take these at least 2 hours apart.